And thanks for staying with Morning Live. Now, the Truth and Reconciliation Committee unit located in the Department of Justice held a meeting in Pretoria yesterday with the TRC beneficiaries who came from across the country. Now, the intention of the meeting was to discuss the delay of the 2019 tuition funds payments to beneficiaries of the Education Fund as part of the TRC recommendations. Now, the meeting also discussed other forms of social assistance, including education, health, medical benefits and housing in trying to meet challenges faced by beneficiaries. And we joined now by Lufuno Mmbadi, she is the director of the TRC Unit in the Department of Justice and Correctional Services. Also with us, Onalenna Mathe, who is a TRC Education Fund beneficiary. And from our Pretoria studios, we're joined by Dr Marjorie Jobson, the National Director of Khulumani Support Group. And thanks so much to all of you for coming through. Let's just get straight to it, starting with the unit, this TRC unit. If you can, Lufuno, just briefly give us an outline of when it was established and what it does and how many beneficiaries it is taking care of at the moment.
Good morning and thank you for the opportunity. The TRC unit was established in 2005 and the work that we are doing is mainly based on the recommendations that Parliament approved, that is TRC recommendations, and those recommendations are under 4 categories. It's individual reparations, symbols and monuments, community rehabilitation, and the last one is medical benefits and other forms of social assistance. And in terms of the number of beneficiaries that we are currently assisting, I think I should narrow it down to yesterday's meeting. We currently assisting under the medical benefits and other forms of social assistance students with educational assistance. The reparation actually assists from grade R to grade 12 in terms of basic education. And then with higher education, we are assisting adult education and training. We are assisting with skills development. We are assisting with further education and training and higher education and training. Now, under basic education, we are sitting at 1,800 plus numbers for 2019. And with higher education, we are sitting at 483 numbers for 2019.
So interesting, because that in itself, the numbers, is not without controversy. And I want to bring in Dr. Marjorie Jobson here with regard to just talking about, you know, who ultimately was seen to be, you know, basically a beneficiary here and those who remained outside of the process. Let's talk about that controversy and government's role in it.
Sakina, thank you very much. We had a very important and constructive meeting yesterday. These education assistance regulations were implemented in 2011 and it has been filled with many, many challenges. Onalenna will explain her own struggle to be able to access the benefits. The benefits, as Lufuno has explained, have reached about 1,500 basic education beneficiaries and about 500 higher education beneficiaries. Now, the big gap that remains, there are multiple gaps. The TRC recognized about 16,800 people as competent to apply for this support. This means that only 500 applicants have benefited to date, since these regulations were passed 8 years ago. And so there's an enormous lag in terms of one of the most transformative remedies for the children and grandchildren of direct victims of these apartheid atrocities. So we discussed at length yesterday what the challenges were. We appreciated the complete honesty and transparency of the meeting, attended by the Deputy Minister and his colleagues and the TRC unit. But we think there are still many grave issues related to how difficult it is to actually access these benefits. And as we learned yesterday, there are up till now still no regulations for health or housing. So the whole agenda for reparations and these critical areas of need that the TRC identified is very, very delayed.
So, Onalenna, coming to you with regard to some of the challenges that you faced, your father was, of course, identified as a beneficiary. So, talk to us about the practicality of accessing these funds.
My father was involved around in 1987. He was involved into politics, apartheid and all. So the government decided that they should decide if they should give my father a house, health, medical aids or something like that. And my father decided, you know what, I'm going to give my child a bursary. So that's when I started to know about bursary, because I completed my matric in 2017. So last year I went to Rostec FET Technical College to rewrite my matric, to upgrade my marks. And the bursary still did not fund me. It only funded me around November. So from January till November, I was still struggling to write my exams. All thanks to Dr. Jobson. She truly did help me. Even this year, she helped me with my accommodation and meal. But still right now, currently, the bursary is still not paid. But I'm still hoping to get
But before I come back to Lufuno, what were the reasons given to you for this delay in payment?
Okay, Ms. Lufuno did explain to me that I was not explained. They did not explain to me that I should get an SOP document from the NSFAS, right? So I only got it later on. And after I found it, I did complete it and I did send it to them. But I still did not get any feedback about the SOP document. I'm still trying to call them and I'm still trying to find out, but it's very difficult getting hold of them. So,
Lufuno, if you could perhaps just explain, maybe for others who are also struggling, why is it so difficult? What are the discrepancies? Where are the loopholes here?
Please, before I do that, can I also just correct what, with due respect, Dr. Jobson Marjorie said. The regulations came into effect 2014, not 2011. We only started implementing them in 2015. Now, with regard to Onalenna's case, I think I should just explain the process. The Department of Justice receives applications from students or from beneficiaries. What we do, we then verify the TRC identified status. And once we're done with that process and we show this is a TRC identified beneficiary, we then send the documents to the administrator. According to the regulations, Higher Education and Training administers the regulations on our behalf because they're an expert department with regard to education. That means testing and approving of funding for the students. Basically, that then would mean the relationship between the institution, the student will now shift over to NSFAS. And with that, we then expect that higher education through NSFAS will then communicate with the students in terms of being told that you've been approved for funding, and then give the student the details in terms of what ought to happen for them to finally get the funding. So that unfortunately did not occur in her situation. When we picked that up, I then informed her that she needed to go to the institution and make sure that they give her an SOP, which is a document or a contract between herself, the institution, and NSFAS, for her then to be funded. And we do apologize that that was not done on time. Those challenges, as Dr. Jobson Marjorie has indicated, were discussed yesterday, and the department is looking at, or it's working on changing what the challenges were, so that from 2020 we actually have a smooth running of the regulations.
So what I also find interesting, Dr. Jobson, you spoke about 16,800 beneficiaries who are identified. Yes. And if one looks at the struggle for liberation in this country, if you look at the fight against apartheid, that number seems rather small. In terms of the people who would then qualify. Can you explain to us how that was arrived at? Dr. Jobson?
Sakina, the issue for the TRC was that it closed for victims within 18 months. It closed on the 14th of December 1997. At that point, people were still delivering statements to the TRC, but they were told, we reject your statements because you've missed the deadline. And there has been no reopening of the possibilities of having victims register, which is now accepted internationally as best practice, because our biggest fear is the people who were in the most disadvantaged situations in rural areas and in homelands were excluded through those arbitrary bureaucratic decisions. So we are still campaigning that all people who were victims of the TRC identified violations should have the assistance of these remedies, equal justice for all victims of the TRC. And that remains one of the biggest challenges. And unfortunately, as we were told yesterday, the law is incredibly constrained of what the TRC unit can do. But we're very glad that there are new efforts in Parliament to demand the opening and the recognition of all TRC victims going forward. It is the only solution to this problem in the long term.
But just coming back, Lufuno, but maybe before I come to you, let me go back to Onalenna, because you spoke about some of the constraints that you are faced with as the unit. Do you have medical aid at the moment?
No, I don't.
And where do you live?
I live in Vereniging. My school is situated there, but originally I come from Pretoria, Mama Fubedu in Free State Province. So, yeah.
And your dad, where is he? And does he have a proper house? Does he have a housing facility? Does he have medical aid?
No, he doesn't.
What is his status right now?
He's unemployed. He's currently at home. He's not working. He's staying in an RDP house. Doesn't have medical aid.
So, and I'm asking this, Lufuno, I think you can see where I'm going with this, because these are things that are legislated, that should have been implemented, and yet here she is sitting next to you. None of what was promised to her has actually materialized.
Yes, I think as also Dr. Jobson Marjorie did indicate, yesterday we also looked at the other benefits under medical and social. And yes, we spoke about housing as well. There is a lot of progress in terms of housing. The guidelines have been developed, and it was indicated in the meeting yesterday that those guidelines on housing are going to be communicated with the affected beneficiaries in terms of what is in the guidelines, which speaks to the spec or the type of housing and the other types of reparations, which should then be rolled out to the different beneficiaries. In terms of health, we also discussed yesterday that draft regulations were completed and were consulted in terms of going out for public comment. But then we need to work with experts departments, as I've indicated earlier. We work with the Department of Health, and when we consulted the draft regulations with health, they then said that they would have to amend their National Health Act to absorb our beneficiaries, to absorb our beneficiaries as a special group. So they wanted to change the definition of the vulnerable group in their act to include TRC identified beneficiaries, so that they're then able to assist them under the vulnerable group.
And we know that could take quite a bit of time, and already people are waiting.
Yes, I agree.
So I'm not even sure what to say here, where to go, because it's been such a long time, and we're still talking about challenges, we're still talking about pitfalls. Is there any real will to deal with these matters and expedite, the process so that people actually get what is due to them?
I would say there is real will to get this done. Yes, there have been challenges, yes, there have been delays. But honestly speaking, there is real will to get this work done and to get the beneficiaries receiving the reparations that are due to them. Maybe also just to go back to the 16,000 number that Dr. Jobson Marjorie and yourself referred to. The reason why maybe we have lesser numbers of people that are applying for the education reparation is lack of knowledge in terms of what is there. So what we've done to try to circumvent the situation, we are doing road shows. Currently, as I'm speaking, we do have the colleagues out there in the Eastern Cape this week. We're doing road shows, going to different areas to make people aware that actually, as we looked into the TRC reports, we've realized that your name is there, this is where you're staying. So we've come to you to say, please, can you apply for this reparation, which is available for you, for your dependents and also your relatives that will do qualify. I think at the beginning, 2015, 2016, we probably concentrated on specific areas which we feel now they have sufficient knowledge, and that's why we're spreading out. Why am I saying this? I'm trying to share this information to show that there is willingness on our part to make sure that the people should have what is due to them, which is the money in the President's Fund, which is intended for the different type of reparations.
And I'm hoping that we'd be able to do more together to create that awareness. Dr. Jobson, just a final word from your side.
I think, Sakina, we would love to have a very meaningful partnership with the TRC unit. Mm-hmm. As you know, we have a very extensive database. When they couldn't track down people, we did a lot of work and found people. Our issue is also that all of the people in Khulumani are struggle veterans, and the military veterans learned from our policy proposals and won for themselves all the benefits, including education, housing, health, and multiple benefits. And those same benefits need to benefit all struggle veterans. One of Lufuno's previous bosses, who's now late, Dr. Mochubela Seku, he said the only solution is that all struggle veterans, whether they were trained in using weapons or not, should have equal benefits to help transform the legacies of the trauma of the past.
Well, thank you so much to all our guests this morning. Dr. Marjorie Jobson, National Director of the Khulumani Support Group, Lufuno Mmbadi from the TRC Unit at the Department of Justice. She's the Director of that unit. And Onalenna Mathe, who's the TRC Education Fund beneficiary, discussing some of the challenges faced by beneficiaries who haven't received funds due to them, including that for schooling. And a conversation that we will take further. But let's take a quick break.